Esteemed dignitaries, dear faculties, and my dear students, greetings from Shivalaji Vidyapit, popularly referred to as SVV, a University of Health Sciences being located in Pondicherry. At the outset, I take this opportunity in expressing my sincere thanks for giving me this opportunity to share some of my thoughts on intellectual property rights in health sciences, its pathways and outcome. I shall share some of my thoughts on research in health science institutions with its pathways and outcomes. I'll take 20 to 25 minutes of your precious time to first I'll identify the need and relevance for a research and innovation ecosystem in a medical institution, being it a medical college or a health science universities or allied health sciences institutions. And we will try to identify what are the various research pathways and outcomes of so-called research in a health science scenario. And next, I'll discuss some of the strategies that can be followed to develop and health innovation ecosystems. One strategy is to develop an health innovation ecosystem. When we talk about the need for a research and innovation ecosystem in medical institutions, it has got four important components. One is research is being carried out for various purposes, either for newer treatment or a proof for innovations or for a evidence-based practice or medical education research. We understand in day-to-day activities of a faculties, which can be broadly of either academic, patient care, outreach activities, or research. Among them, research is the soul of a health science institutions. Relevance of research and innovation in medical institutions are many. Research and innovations usually results either in research paper, mostly, also in other intellectual property right activities such as copyrights, patents, or technology transfers. Most important, frugal innovation that produces products or services that are affordable by more people at low levels of income without compromising qualities. It also transfers from a knowledge producing economy to a knowledge sharing society that will have relevance to many parts of the world and to the people at large. In this background, we understand that the medical world, what was that in last 20th century and now currently in 21st century, is evolving. Hence, it is essential as a faculties to keep up with the changes. By carrying innovative research work, faculties have important role to contribute and make a difference in health sector, however small it may be. Hence, faculties should consider becoming involved in extracurricular research in addition to their busy schedules to fuel their intellectual intrigue, assist in continuing medical and professional development. Need for research are many. First and foremost being is to create evidence for practice or to implement new health practices or to test innovative ideas or to disseminate the innovative research to public, to guide the future researchers and above all to improve teamwork and collaborations. Now, when you think of what are the various outputs or outcomes of so-called research in a medical institutions, it has got many outputs. First and the most important is the research publications. That is most important component of the research in a medical institute or a health science institutes are being evaluated, are being judged by the quality of the publications and the publications in so-called journals of high impact factor and other things. In addition to the research publications, other things that includes intellectual property right includes copyrights, patents, technology transfers that ends in commercializations are some of other noteworthy outputs or pathways in this research activities in any health sciences, universities or institutions. I like to share with respected faculties an important paper published by Ray et al. In the year 2016. I am sure many of you would have come across this interesting paper which speaks volumes about the quality of the research activities outputs in most of our medical institutes during 2005 to 2014. The authors, first they compared their output in terms of research publications with some of the leading academic centers in the world. And what they observed was that only 4.3% of the total institutions, that is 579 medical institutions and hospitals in India, that makes 25 institutions produce more than 100 papers a year, and their contributions was 40.3% of the country's total research output. And also 57.3% of the medical college, unfortunately, did not have a single publication in a decade that reflects the scenario of research culture, non-existence of research culture in medical institutes or colleges that even didn't culminate in a single research paper in a decade. In comparison, when they compare the annual research outputs of the Massachusetts General Hospital and the Mayo Clinics, it was large numbers compared to 4,600 and 3,700 research papers published, respectively. The authors also found that the majority of the institutions that accounted for the bulk of research output in India, particularly AIIMS, PGI, JIPMER, Sanjay Gandhi, and other major institutes in India were publicly funded. This study concluded that the overall research outputs from Indian medical institutions in essence is poor, hence needs a big boost to enhance the quality of the output in terms of good number of publications as well as quality publications. I like to share with a table that gives statistics about the research publications in medical institutions in India and internationally since the year 1970s to the year 2020s. In the year 1970s, India's contributions to the number of research publications was very minimal, very less. It was around 0.02% of research publications. And during the years, slowly it went on increasing, and in the year 2020s, India's contributions was nearly 3.6.8% of the publications, amounting nearly 59,751 publications. And when we analyze the publications in terms of their citations, self-citations, or citation per document, or H-index, United States was number 1, followed by China, United Kingdom, Germany, Japan, Italy, France, Canada, Spain, Australia, and India was the 11th country with more than 441 authors having H-index and 11.82% of citations per documents. In this context, when we analyze another output of the research in a medical institutes, that is intellectual property right, that includes copyrights, patents, technology transfer, commercialization of the products. When we analyze the global patent applications, it means intellectual patent offices that are receiving the most patent applications. It was observed that more than 85% of all patent filings in the year 2020 occurred in the IP offices of the China, US, Japan, Republic of Korea, and the European patent offices. China accounted for more than 45.7% of the world patent applications. Similarly, when patent applications for the top 10 offices was analyzed, India stood seventh among the countries having more than 56,771 patent applications compared to China, which topped the applications processing in their countries. In the year 2020, China's IP office received 1.5 million patent applications. It was followed by the offices of the US, Japan, the Republic of Korea, and the European Patent Office. Similarly, when we analyze the trends of patent processings, patent publishing, and patent granted among the three countries, China, United States, and India. Since 2011, China is developing very fast with large number of patents since 2020, but unfortunately, India's activities on the patents is very low. We are having a same or more number of patent applications since 2011 to 2020 without any major differences in the large number of patent process applications. And particularly when we talk about the medical technology patents that has been processed or applied for or published in India compared to other countries, China contributes more than 41.7% of the total medical technology patents compared to United States of 58%, and India's contributions to the patents that helped in medical technology is only 0.3%, accounting only for 2,645 patents till now. This table gives the data about the number of the institutions or universities in India that has been contributing mostly to the patents scenario since the year 2013-14 to 2017 and 18. Of this, Indian Institute of Technology taken together has been a major leader, contributing most of the patent activities in the country, followed by other institutes, but definitely there are very few health sciences universities contributing to these patent activities. Hence, to boost the IPR activities that includes copyrights, patents, technology transfer, and commercializations, one needs to support a good health innovation ecosystems. It can be achieved by various ways, first and foremost being to provide a broader platform for innovation, to encourage innovation for inclusion aimed at the bottom of the pyramid, foster necessary ecosystem, focus on drivers, and expand space for discourse on innovations in the countries. When we talk about providing platform for innovations, what should include? It should not only include products, but also services, processes, science and technology components, and as well as social and cultural values. And to encourage innovations for inclusion aimed at bottom of the pyramids, the institutions which have very minimal IPR activities, the first and foremost initiative to be about awareness, to make the faculties, students, and all stakeholders aware in the health science institutes about the IPR activities that spreads from copyrights to that of technology transfers, about their importance, about their role, and about their contributions to make the indigenous technologies in the health sciences for taking the care of the large number of the people with low cost technologies. Then to foster necessary ecosystems. There are various ways, approaches that can be followed and can be evaluated and can be analyzed for improving the necessary ecosystem for IPR activities. That includes starting up incentives and awards, and for strengthening the policies and programs in an institutions to promote the IPR activities, and also to create innovation clusters at universities. That should be provide a platform for the faculties, students alike to take up these components of IPR activities. And the most important, we must focus on drivers, and drivers that should move forward the IPR activities in the institutions, and that has multi-components. It should be multidisciplinary, collaboratives, and should be of locally relevant. Technologies should be relevant to the community, to the people who should benefit from this, and focus at the edge technologies. So that components are most important for moving forward IPR activities in the medical institutions in India. And when we talk about space for discourse, it should through achieved many ways by conferences, seminars, new ideas, debates, discussions, and best practices that will contribute for development of IPR activities across many of the institutions. Before that, I'll share some of our activities of IPR in our universities. Sri Balaji Vidyapith, we have been working and progressively to encourage IPR activities among the faculties and students as well of our universities to focus on commercialization of products. To give a few examples, we have initiated, commercialized one universal back resting device for the dental chair, being extensively used in dental chair, now being commercialized, being available in the market at a low cost compared to other costs. Other examples like that, we have also commercialized a rapid response disaster relief kit for the use in different situations. In essence, if we have got wish, if we want, we can make it. And I do personally believe this is the century, this 21st century, in addition to the research publications, which is the main important outputs of the research ethos scenario in Health Science Institute in India. Obviously, IPR activities have also to play an important role. And these IPR activities in terms of patents, commercializations should be encouraged, innovations should be encouraged, and ecosystems should be nurtured so that a sustainable innovation in medical research ecosystem should be able to balance improved health system, health research, so that the patient from the low socioeconomic status and who can afford this indigenously developed technology with a minimum cost. Research in medical colleges therefore need to be aligned with National Education Policy 2020, Industrial Revolution 4.0 that talks about artificial intelligence, robotics, Internet of Things, and big data management, and so on. And only that we have a system in this health sciences universities so that our faculty, students, all the stakeholders are not aware. They also will contribute their might for the betterment of this outcome of the research, either in form of publications or other IPR activities. Thank you. Thank you very much for your patience hearing.